Hi, this is Dr. Mike Jurgowitz, functional medicine practitioner, and I wanted to spend a few moments to talk about how functional medicine can help those that were previously diagnosed with irritable bowel syndrome. So, irritable bowel syndrome is a complex chronic disorder that's characterized by abdominal pain or discomfort and altered bowel habits. So, the challenge in the traditional model is it's a functional disorder. So there's no anatomical abnormality. It really involves that gut-brain axis. And about 10 to 15% of the population have IBS. And most of the individuals that I work with previously see their GI doctor and they may have had a colonoscopy or an endoscopy, and those things are normal. So they kind of ruled out any sort of pathology. So from that perspective, it really lends us to how does functional medicine work in these individuals. So it's important to know that there's several different classifications of IBS. The first is constipation predominant, there's diarrhea predominant, and then there's mixed. And these can have different underlying causes and triggers, and they also can have in these cases, we would be typically using different nutritional therapeutics, but where functional medicine shines for individuals that have IBS is we can really look at some of the different specialty lab testing to look and see how your physiology is not functioning normally. So a traditional doctor may look at a stool panel to rule out any sort of pathogenic bacteria, but a lot of the specialty labs that I work with will still test this pathogenic bacteria, but you're also looking at what are the populations of your beneficial bacteria? What are some of the opportunistic populations there? Is there any fungus or yeast markers? Is there non-pathogenic parasites present? And then it has a whole list of different stool chemistries that look at intestinal health, such as digestion and absorption function, immune and inflammatory markers, markers around intestinal permeability, gluten sensitivity. So you really get a sense of how the overall GI environment is and how that GI is functioning. And then based upon this objective data, we can put together a personalized approach with diet, lifestyle, and nutritional therapeutics. And then in these individuals as well, often have what are considered food sensitivities, which are much different than food allergies. And these food sensitivities can also have underlying intestinal barrier dysfunction, and about 10% of those with IBS also have small intestinal bacterial overgrowth. So the functional medicine model really allows us to use some of the specialty lab testing that's out there to see how your physiology is not functioning normal, and then we can address all of these from a diet and lifestyle perspective.